came here and immediately felt like part of a team. And I felt like we were taking care of a community together.
We really try to tailor our residency to match the needs of the individual resident.
In this program, there's a great foundation for support and mentorship. It exists every day.
Many of us have an approach where we see our residents as junior colleagues while also appreciating all the growth and learning that has to happen during residency.
I think what brings people to BIDMC for their training is they're really looking for a place that values the individual, that really values the relationship between colleagues as well as between providers and patients.
I'm from Boston, and I looked at a lot of the Boston programs, and I knew that this program in particular, once I met with some of the people during my interview process, I felt a little bit at home. I felt like the people just wanted me to succeed before I even got here.
Our residents get a lot of hands-on training. There is no shortage of that in our residency program for sure. We do 5,000 deliveries a year on our labor and delivery unit, and our residents are involved in every delivery.
It's wild, and I say that because I anticipated coming in and starting and doing a C-section on my first block of L&D, and that happened.
The hands-on experience is immediate, safe and methodical in the way you're advanced and taught through those kind of practical experiences, but certainly there's no holding back.
Our residents have the opportunity to work with a range of providers, from generalists to complex cases with GYN oncology and urogynecology, minimally invasive gynecologic surgeons, REI, and they care for those patients on the floor as well, so they really have the opportunity to learn a wide range of surgical skills and complex medical care as well. We're fortunate to have, full range of vaginal, laparoscopic, robotic surgery cases as well, with a pretty robust volume, so our residents really get to learn a lot of complex surgeries.
Really looking for somebody who is going to be excited about the program, going to be providing excellent patient care, and has a growth mindset.
Someone who's going to be a good colleague and ready to be part of our family. Our residents here at BIDMC have a lot of unique opportunities.
We get exposure to all of those different kind of niches of practice here.
We have really strong family planning training. We are able to practice to the full extent of the law.
I feel incredibly lucky to, one, live in a state where this care is accessible, and BIDMC has been really supportive of maintaining patient access. And we even do have some residents travel from out of state to come train with us because they're no longer able to get that training in their state.
I started residency in 2022. That summer was when the Dobbs decision was handed down by the Supreme Court of the United States, which removed the protections that Roe v. Wade had afforded our women for many years. Applying while knowing that that was on the docket and on the horizon, it was really important for me to go to a program where I would get protected family planning training.
Our residents have a really strong relationship with ACOG. We have a very strong culture of recruiting residents who want to be advocates for their patients, particularly now in this current political environment.
We get the opportunity to rotate to community hospitals as part of our experience here. And so you do get the flavor of both of them.
As the only tertiary care labor and delivery unit in the entire BILH network, we are getting all of the complex OB care patients.
I think something really special about BIDMC is that we see all of the most complicated patients. We see what complications look like, and we get an idea of how to actually manage them. And I think that prepares all of us really well to whether we go into a job at a big academic center or at a smaller place out in the community. We've seen all of those problems, and we've learned how to deal with them as residents.
We have a really unique relationship with a hospital in Botswana where residents can go train alongside residents in that country, and the residency program director there is also a faculty here in our department, so it's a really close relationship.
Research is a component, I think, that's crucial to any residency program.
As a resident in probably a lot of other places, you feel like you have to go out of your way to get involved in research, but I really almost didn't have to try to get involved in things.
We're very lucky here at BIDMC to have, in our OBGYN department, a research division with very experienced researchers led by Michelle Hacker and her team. These are non-clinicians who have worked in women's health research for many years. We also have one of our generalist divisions, Steve Wagner. He also brings a clinician's perspective of how to be a productive researcher while keeping up a busy clinical practice.
We are paired with a residency research mentor to be able to craft something in this time that we have. And when I say something, I mean more so like a publishable product.
When you are trying to figure out what residency program is right for you, you can't underestimate the importance of having people around you that you're going to enjoy working with day to day and who are going to support you.
I think our culture is phenomenal. I think people really do care about each other, and I think that's the most important thing when you're doing such a hard job.
We like to foster a family-like environment here in our department. If several of our co-residents are off together, we get so excited to finally have the opportunity to spend time outside of work, despite the fact that we spend, 80 hours a week here at the hospital together. So I think that speaks volumes about kind of the support and the collegiality and the friendship that we have.
I think residency can be difficult no matter what specialty, no matter where you go, and I think many of us faculty joined the residency leadership team because of the positive resident culture that we have.
They will truly go above and beyond for their colleagues, and I think for many of our residents, coming to work does not feel like work.
I think Boston is a really special place to live. It's a beautiful city, it's a charming city, we have beautiful seasons.
I think the great thing about Boston is there's so many different types of neighborhoods that you can choose to live in and explore, different kind of cultural centers, and tons of amazing restaurants and places to eat and things to do.
Boston has so much opportunity to kind of live a fun life outside of residency that you can't get everywhere.
I think coming here would expose you to the full scope of OBGYN care from day one.
BIDMC is really special and I would choose it again.
It wasn't long ago that I myself was in residency, and it's a grueling 4 years, but I think if you are surrounded by people who support you and you're surrounded by people who believe in you, that's what it's all about.
I would say that if they're looking for a place where you'll get excellent clinical experience and exposure combined with a culture that is warm and generous and collaborative, then the BIDMC is the place to be.
If the potential resident is here watching this video, congrats on choosing OBGYN. It is the best specialty. My advice would just be to get to a place where you feel that joy, and I feel that joy here every day.